Carbon Health is a technology-enabled medical group. I'm sure everybody is familiar with that at this point, but I think what it allowed us to do as the pandemic started is really provide a unique opportunity that allowed us to kind of propel ourselves directly into the pandemic. We certainly have a tendency at Carbon Health to run towards the problem, and we saw the pandemic as an important problem that we could help to both manage and to provide access and care. So we provide urgent care, primary care, mental health, and we are looking at other specialties and service lines. But most importantly, our mission is all about just making world-class healthcare accessible to everybody. And I think we do that in a unique way because we're able to really leverage technology in a way that helps us to automate, create efficiency, create extra points of access that are not available, or certainly as readily available in more traditional healthcare providers. Next slide, please. So during the COVID-19 pandemic, we've had a number of firsts, which we're proud of. You know, we were first to set up a database of all testing locations, and early on in the pandemic, we saw as very critical because it was just difficult to understand where you could even access it. And certainly Carbon Health was not necessarily going to be the solution for everybody everywhere, but we felt it was important that we tried to play a role in helping to create access, even if we weren't providing the access. So just so you know, our database for testing locations is actually what powers Apple and their directory, as well as Google and their maps. We're the primary partner for the city of San Francisco, and we've done over 1 million tests with them. We've done 500,000 across our other locations and access points in Carbon Health. And we've helped other municipalities as well, City of Los Angeles, Oakland, numerous other governments and other organizations that didn't have necessarily the resources at the ready to quickly mobilize testing, especially in some more time critical or sensitive situations. We were the first walk-in testing center for the city of LA. And as a result of our work, we've been fortunate enough to be recognized with some awards you can see at the bottom. Next slide. Oh. So I think we're gonna start to open it up. Caesar, I'd love for you to add any comments if you want now that you're on. I did tell everybody we actually are a technology company, even though we had these Zoom issues at the beginning.
I know.
And then we can kind of dive into questions.
Perfect. Yeah, I was hearing the discussion. I think you said it beautifully, but one of the things that makes our efforts slightly different than perhaps what you're seeing and hearing and reading about around the country is that we have the benefit of leveraging technology in a much more nimble way than traditional healthcare providers or even public health departments. And so we're literally going around the country asking now government organizations around vaccines, but prior to that, really any organization that needed help and assistance, we're working with them to get them back to work safely, get them diagnostics more efficiently, and then now I think we're all very proud to do the same for vaccinations. And so I'm really excited to have this conversation today.
Yeah, absolutely. It's really the next chapter in our mission.
Yeah. And just like Zoom, we're multifunctional. So so Carbon on the iPhone right now, Zoom on my iPhone. I apologize for how the view is coming out, but it seems like webinar is different than regular Zoom. Cool. So it sounds like we should maybe talk a little bit about how we got here with vaccines and how vaccines were developed. I know we've put out an FAQ around all of these issues. So one of the questions that comes up, and Sujal, I'd love to get your point of view on this, but can this vaccine be trusted? How is it that we went from brand new virus identified initially in China, and to vaccine in less than 1 year, when most other vaccines take multiple years, if not closer to a decade, depending on which one you're looking at.
Yeah, I'll start, and Caesar, you let me know what I missed. But I think it's pretty miraculous how quickly this vaccine's been developed. But there's a few reasons for that. Number one is obviously we were able to sequence the DNA of the virus in the very early stages of the pandemic, which also helped to facilitate testing. But that same knowledge and awareness is what helps us understand how to target the virus, as well as to help manufacture the proteins that can develop an immune response. And I'm sure we'll probably talk maybe a little bit more deeply about mRNA and what that means as a vaccine platform. But the mRNA vaccine platform and that technology is part of why we're able to manufacture this so much faster. But the other specific reasons are, all of the steps that are required in vaccine development have been fulfilled for this vaccine. It's just that they were compressed more than what would happen naturally, because normally the business of vaccine development is not extremely lucrative. So it doesn't tend to get the same amount of resource as some other drugs that probably have higher margin in the pharmaceutical industry. So they tend to get funding for each phase of development in slower stages. That was greatly accelerated when the federal government helped to subsidize a lot of that, so that we were able to go from phase 1, 2, 3 and overlap where we could in those research trials, so that we were able to get the data faster to get the scientific approval that would be needed even if this wasn't a pandemic. So I don't want anybody to think that there were shortcuts taken on the approval process, but it was more that we're able to compress and facilitate through the subsidization, through better coordination. And then the other piece that was an accelerant was the fact that as there was an approach towards a final candidate, there were basically bets placed, and large amounts of vaccine were produced of these final candidates in anticipation that they may be approved. So when they were approved, there was already a small stockpile of vaccine that was ready for distribution, because normally that would have added yet another delay after approval.
Yes, it sounds like part of the acceleration was getting rid of the parts of the bureaucracy, or accelerating through parts of the bureaucracy that often get in the way, as well as the financial risk that vaccine creators often take. So by the government stepping in and saying, look, we'll backstop the financial risk and we'll accelerate through our typical processes, but we'll adhere to the science, to make sure that it's safe and effective. It seems like that's what you're referring to.
Yeah, and I think it's unfortunate that wasn't underscored even more. And
Yeah.
I think there were a lot of things during the pandemic that have been politicized. And this was one of those that's a little unfortunate, where, the real shame in that, or crime in that, is that it's going to lead to uncertainty, which leads to vaccine hesitancy that may not have been there. There'll always be some vaccine hesitancy. I certainly would never advocate that we're going to force a vaccine on somebody, but we don't need extra uncertainty where there didn't have to be it.
Yeah. Also, and around that point, I think there have been quite a number of, there's been quite a bit of discussion around, is this safe? Is this effective in all populations? Not just the typical white males that have been studied, in really the vast majority of drugs that are developed. What are your thoughts around that? I mean, what do you tell your patients when they ask whether this is safe and effective? And if it's safe and effective in my population, in my certain population that they're referring to.
Right. And I think that's a great question and a great topic for discussion. How I speak with my patients or colleagues is really to let them know that when you look at a broad sample, there is representation from many groups, but there may not be enough representation to speak definitively about certain segments of the population, or if we start to break down, even some higher risk categories, we still need more data about that. But what we've seen shows such promise because there's, for Moderna and Pfizer, 95% efficacy in really preventing serious complications from COVID-19, which are the ones we are concerned about, which is those are the ones that are going to keep you out of the emergency department, out of the hospital, and out of mortality as well.
Now, so you just said something that's pretty subtle, but really I think needs to be underlined and highlighted. So the vaccine prevents you from getting moderately or severely ill with COVID-19. Does it help you see your elderly parents, grandparents, family members? So if you're vaccinated, can you go back to normal life?
Yeah, I think the short to medium term answer to that is no, because certainly until we have much more penetrance of vaccination into the population, honestly, I think we're actually entering a phase where we have to double down on the vigilance and precaution that we've already been taking. So I don't think it's time to throw away the masks. I think we still need to maintain those basic measures. I tell people it's like the seatbelt and the airbag, right? Of the pandemic, the masks and the distancing, because what we know about the vaccine is, as you say, it's effective in preventing serious complications from infection. What we don't know yet, but I'm hoping we will know within the next few months, is whether it actually prevents infection or at least reduces infection to the rate where you're no longer transmissible. And that's the key part that we just don't know yet. So we don't want to unknowingly get a false sense of security because we've been vaccinated and then be around other folks who are vulnerable, not vaccinated yet, and unintentionally infect them.
Yeah, so you could theoretically be a carrier, not get sick, pass along the virus. And the reason that we can't take those masks off is because the studies didn't really do that. The studies after people got vaccinated didn't go out and swab them daily or monthly or weekly to see, whether or not people had an infection.
Yeah, and that's absolutely correct. And Cesar, you just touched on that was the part of the study design that wasn't there. And I don't fault the vaccine manufacturers for not doing that in that early phase, because really what the job was at that time was just to understand about disease burden, because that was what was potentially either crushing communities or the risk we were worried about. Now it's time to go back and do that other aspect of the study where we do, frequent surveillance testing and understand if there is a situation where folks who've been vaccinated are still getting infected and transmitting virus.
Now, there's been a bit of controversy about should more people get just a single dose of vaccine, or should we focus on getting fewer people who are perhaps at higher risk, both doses of the vaccine? Can you explain that and kind of what that, how that came about?
And it's funny, I've been in probably more public health meetings recently than I've been in during my career, because we're trying to help a number of counties and municipalities around vaccination efforts. And I think that what you're describing is a dilemma. In an ideal situation, you would be able to give everybody the 2 doses and everybody would get maximal protection. But I think that in order, and I don't have a right answer, but I think that what we're trying to weigh here is, do we try to get everybody some protection, or as many people as possible, right? Some protection. And after 1 dose, we know that it is potentially somewhere between 50% if you see Pfizer's data, and maybe up to even close to 80% from Moderna's data, that there is protection after 1 dose. It just isn't the 95%. I personally believe that getting more doses into more people is probably the right decision to make today. And so, because it allows us to then think about how do we get the second doses in. But if you just focus in on one part of the population, you're really not going to do enough to help to reduce the overall disease burden and transmission across your community. So I think that in my opinion, I would vote for the let's vaccinate as many people as possible, and then let's worry about how to do the second dose.
Yeah, and I have to say I agree with you on that. I think that we've got to get as many vaccines into as many people as possible, especially because there are new variants. There's a question regarding the South African variant and the Kent variant. Now there's a California variant that UCSF identified just within this past week. And all of these variants seem to be mutations in the spike protein, which is where this vaccine is aimed at getting. Now, most studies seem to suggest that at least the immune response is so robust with the vaccine that even if people were infected with these variant strains of coronavirus, that the vaccine would be effective. We don't really know that yet. I think we'll have a lot more information in the next 5 to 6 months when those viruses become more dominant, and we can look to see who's been vaccinated and whether or not they're getting infected. So most vaccine creators, and Sujal and I have talked to quite a number of people in industry. So most of those vaccine creators believe that the immune response will be robust enough to protect you, but we just don't know definitively. Sujal, I've got a question from Kaylin Soldat, and this is a reminder for the audience. Please feel free to post your questions. This is a wonderful Q&A and an opportunity to ask us anything you'd like. But the question is, how do you plan to implement vaccines for existing testing partners? Any idea on timeline?
Yeah, so, and that's obviously, I think that's probably the question of the hour, right? That I'm sure a lot of folks are interested in. The simple answer is that it'll be as soon as possible. And I'll kind of tell you the complexity behind that answer. So I don't have an exact date. I don't think if anybody told you an exact date today, I can tell you that they're making it up. And the reason why I say that is because right now we're still in the early-ish phases of distribution and understanding what those distribution channels look like, just so everybody understands how the existing kind of handoff is, or chain of custody of vaccine. It's really going directly from manufacturer into federal hands that is essentially bringing it to the states. And from the states, they distribute ownership typically across the county public health departments. That's the most typical chain of command. And each state is making their own decisions about distribution and administration and how to register people, et cetera, which is part of why we're in the complex web that we are, because there really isn't any best practice or standardization that's occurred yet. I think that will change. But right now it's going through these channels, and then from public health, they're often going to lean on partners that they're familiar with. So that's why you may have heard across many states that it was hospitals or health systems that also happen to have the ultra cold storage that was either required for Pfizer, or at least enough storage capacity to accommodate the Moderna vaccine. And then it would go out from there. So right now we're still kind of in the county and large regional hub aspects of the distribution. As it gets out into other care venues, that's when I think we're going to start to see administration really unlock, because really what we should be able to do is deliver it in our clinics. Now, I will say that we're prepared, where we have made infrastructure investments to be able to be recipients of the vaccine. So wherever there's a carbon footprint, we want to make sure that that becomes a vaccine access point as well. But but there's going to be a lot of again, variation and complexity around that last mile of the distribution. Right now, most of the vaccine is actually being funneled towards mass or large community-based vaccination sites because they're the most efficient today. So as an example, I'm in Los Angeles. In Los Angeles, we have sites that are community-based that might be servicing 1,500 to 2,000 people a day. We have Dodger Stadium that we just opened up, and there we're already servicing well over a few thousand people per day with the intent of getting to about 20,000 per day. So those sites are going to kind of suck up a lot of the available vaccine supply. I think for at least about the next 3 to 4 weeks. That's my prediction.
That's super helpful. And I think, a little bit of like inside baseball on this one, if I may, just for the people in the audience, because I think the efforts of what you and Carbon Health, the entire team has been doing in Los Angeles is quite heroic. So a bit of background, Los Angeles County was working to get vaccines distributed to initially healthcare workers and people in long-term residential facilities. Unfortunately, they encountered some difficulty with their initial partner, and then came to Carbon asking for potentially a partnership to try to distribute vaccine. Within a matter of days, Sujal, you and the team were able to go live with a website where people could go and schedule vaccine, and then quickly scale to, with the same workforce, double capacity in existing sites, and then start really coordinating a site at Dodger Stadium where you can now vaccinate 10,000 people a day in a very, very efficient manner. And if people in the audience have family members who are 65 and older in Los Angeles, please go on to our website and ask your family members to be scheduled, because of how efficiently you were able to mobilize the team to get vaccine into arms. It seems like now you're looking to actually vaccinate people who are 65 and older. So really going to where the governor wanted to go in California. I know that you've been trying to do this, and we've all been trying to do this around the country. So hopefully, for those who are on the call, you'll see more and more of these mass vaccination sites coming on board through Carbon, and we can be kind of your trusted partner in that. I would say, and this is going a little bit off script, but if you have connections with your local county officials who might have access, who might be struggling to vaccinate the population, we would love to partner with them. I think we now have some capacity, probably the most experience in the country for doing this at scale, and we would, we're willing to go into other communities to do what we did in Los Angeles. So it's a shameless plug for working with Carbon, but the people on this call clearly are well informed and probably know their communities better than we do. So if you have that capability, please reach out to us in whatever fashion you can and make those introductions to your county health officials. Was that okay to say, Sujal, or am I in trouble?
Yeah. You did declare it as a shameless plug, so I think that's okay. And really mission aligned. It's all about, like, I truly believe we are in a race against the virus. And I mean, people may have heard me say this before, but the pandemic has been a marathon. The problem is the virus basically just stopped, changed running shoes, and it started sprinting in the last few miles with these variants. And I think it's really important that we get the population at large across the country vaccinated as quickly as possible.
Yeah, great. I have a great question from Brett Fox. Why hasn't the AstraZeneca vaccine been approved in the US yet? Any thoughts on timing on the Johnson & Johnson vaccine? I think I can try to take a shot at that because I was recently on a call with some industry folks. So Johnson & Johnson expects to have sufficient data to submit to the FDA by the end of January. So hopefully, perhaps in late February or early March, we could get the go ahead. I think part of the roadblock, as you've seen, in various communities, the bottleneck is supply. In I would say the majority of communities, the bottleneck is organization and distribution of vaccines. So it may not help our efforts by having additional vaccines approved and online for the majority of communities that are dealing with this. Now, with the AstraZeneca vaccine, they're actively studying whether or not their vaccine can reduce transmission. So they're actually swabbing people on a regular basis to see whether they have a lower rate of infection than those people in the placebo group. And so we're all excited to see their information in the US. That vaccine hasn't been approved, even though it has been in the UK. I'm not quite sure what the bottleneck is. I unfortunately don't have context at AstraZeneca, but from the data that I have seen, there's a way where the efficacy of the AstraZeneca vaccine in the UK was somewhat in question at roughly about 70% efficacy. But I think there was a sub-analysis that was done afterwards where it showed that perhaps it is actually upwards of 90%. So my guess is that there's some questions about how the data are being analyzed. Like, are we really looking at a huge number of data points and trying to find ways to make the vaccine seem to be as good as the Moderna and the Pfizer vaccine? So that's a guess, but again, from the industry group, that seems to be the general thought of what the delay is. Great question, long answer. From Bobby Johnson, we have curious if you can comment on the recent allergic reactions being caused by the Moderna vaccine, which caused 2 California counties to pause some distribution on the Moderna vaccine specifically. Sujal, do you want to take that or?
Yeah, sure. So, what we know is that they experienced higher than anticipated reactions. To be honest, I don't have the details on the exact reactions, but certainly they were immediate or very soon after administration, which is concerning for an allergic reaction or something that might lead to even anaphylaxis, which is a much more severe form of reaction that can be even life-threatening. Because of that, out of precaution, that lot was pulled, off the inventory shelves so that nobody else would receive it. And to be honest, that means that the system was working as designed. When we are administering vaccines as a provider, the onus is on us to make sure that we're following protocol to administer it safely. But part of that also means that we're actually reporting events so that they can be captured. And then in aggregate, health departments, manufacturers, FDA, everybody's kind of looking at this through multiple layers to make sure that there aren't any outlier events such as this that might lead to a question about an impurity or a manufacturing issue around a specific lot, or is there something that's a broader trend across the vaccine in general?
Now, do you have a preference between Moderna and Pfizer?
Not really. I think that Moderna, just from a logistical standpoint, is much less complicated. So I think that there is a good chance. The way I've seen kind of distribution working right now is that the large hospitals or health systems or these regional hubs that I was describing that often have ultra cold storage, I think that's typically where the Pfizer vaccine is going to get held, and distribution will be more in proximity to that. I think that we're going to see Moderna make it further out into the communities. And then as these other vaccines come on board, which may not need, which are a lot like the traditional vaccines we've been giving, I think that that's where it unlocks even more on the access and distribution side.
Oh, that's great. Now, I know you've gotten vaccinated.
Yeah.
Since you're an ER physician who sees patients on the front lines.
Right.
Any problems in your case?
No. So, and I'll tell people how I made my decision about getting vaccinated. There's a very famous physician named William Osler who practiced around the turn of the century. And he had a great saying that I still think holds true today, which is never be the first to prescribe a medication and never be the last. And, when you think about that, I think, it's pretty wise. But, I was willing to be first with this vaccine, partly because I was already seeing the impact and the certainty around the risks of COVID, including for myself personally. Not that I was infected, but I knew what could happen because I was taking care of patients that were like me, younger than me, older than me, and everybody. I saw disease across every part of the spectrum that really underscored to me that, yeah, this is real. It can affect a lot of different people in a lot of serious ways. And so I made a personal decision that the certainty around that risk of disease was way greater than a theoretical risk that there might have been a longer term complication from the vaccine, knowing that the data was already there to capture any short-term complications. So that's kind of how I made my own personal decision. And I share that because I think it's important that people know it will be a very personal decision, right, for every individual. And I think you have to kind of go through your own decision matrix and look at the risks and benefits. And I think as more people get vaccinated, we're going to have even more data about potential side effects or any longer term complications, which will just inform your decision that much more. With respect to my own personal experience, the vaccine itself, getting the needle in the arm, didn't hurt any worse than a flu vaccine. And for me, that didn't hurt much, but I know everybody's, sensitivity to that pain is quite different. But so it was very similar to getting a flu vaccine. My first dose, I just got a little sore in my arm and some aches the next day. The second dose, I felt sick. I felt more aches. I had some chills. I might have had a low-grade fever, but it was gone within about 16 hours, maybe 24 hours, and then I was back to normal.
That's great. Actually, I think you and I had a similar reaction to the vaccine, so fairly mild and reasonable. And clearly, I know that you're intubating patients, so doing those procedures that are, aerosol generating. I want to take this second to take this minute to just remind everyone, please post your questions. We are open for anything on your mind regarding vaccines or the coronavirus in general. So Kathleen Mayer has a question here. Can you offer the vaccine at one of your Carbon Health existing sites that do testing?
Yeah, so we are in process and approved already in many locations, but for where we have physical footprints, as much as possible, we're going through the process and again, making investments around, refrigerators, ultra cold storage, et cetera, that will allow us to be vaccine distribution sites. So we already have that approved for many of our locations, but the intent is that we get it everywhere we can.
For today, are you able to share with us like where we've been approved and perhaps a timeline around when we might receive those vaccines? My sense is that it's probably still government dependent, which is difficult, but just want to get your opinion on that.
Yeah, so as for where we've been approved, I know that we have almost all of our California sites have been approved. And I don't know if that just speaks to the process that they've had because we started the process for everybody at the same time. So I know the other ones are still in process. As for when we'll get it, I think that I'm hoping it might be within a month that we would be able to start doing vaccinations within our clinics. But as I said earlier, I do believe that there is limited supply overall. Even though what Cesar said is true, that to be honest, the supply hasn't been the actual constraint in these early days and weeks because getting it from supply on a shelf or in a freezer into somebody's arm is where the gap has been. So I think as that ramps up, supply will continue to be somewhat of a constraint, and I think that will start to unlock within the next 3 to 4 weeks.
That's super helpful. Brett asked this great question, which I know is on so many people's minds, but given the lack of children and immunocompromised adults in the trial groups, when do you think the vaccine will get those cohorts? I know that you and I and a couple others from the Carbon team were on a call with the FDA, um, and there was a discussion around who should not get the vaccine. Are you able to speak a little bit about who we're telling not to get the vaccine? And by extension, everyone else should be vaccinated. It's thought to be safe and effective, but how do you break that down?
Caesar, I think actually the way you're framing it is the right way to look at it, because I think it simplifies it as simple as it is as a decision. Really, luckily, there are very few groups that are being advised not to be vaccinated. And really, it just falls into if you've actually had an allergic reaction to the vaccine, which means that you don't know that on your first dose, it would only be something where you're looking for your second dose, where you would know, hey, yeah, I had anaphylaxis with the Moderna vaccine. You're not going to be vaccinated again. That's just too high risk a situation. If you're known to be allergic to some of the key components in the solution of the vaccine, like polyethylene glycol or polysorbate, and I know that these are not necessarily familiar terms, but if you have had an allergic reaction to those specific solutions or substances, you would know. So that's why those are actually asked specifically in the CDC intake questionnaire. And then the only other group where we don't advise that they get vaccinated right away is if you've been treated with monoclonal antibodies, because we're a little bit worried it may decrease the effectiveness of the immune response generated by the vaccine. So you're effectively getting the vaccine, but you might not get the response that you're hoping for. And we suggest that you delay that for 90 days after the time of the monoclonal antibody when that was infused. But really, those are the only groups. Everybody else can and should be vaccinated. We do recommend that if you're pregnant or breastfeeding, that you have a discussion with your physician just to understand, potential risks or benefits, because that is a specific group that really was not evaluated with enough data to say with any certainty about the safety or efficacy within that group. Brett, I know you mentioned the children and immunocompromised adults. Those are also cohorts that are worth calling out. Children right now, we don't have the trial data to understand if it's effective below the age of 16. But for immunocompromised adults, there's still just a question mark of if your immune system is compromised and less responsive. It's not that you can't get the vaccine, but the question will be, how effective is it? How much of an immune response are you generating in response to the vaccine? And therefore, can you feel as secure as anybody else because you've been vaccinated?
That's super helpful. Super helpful. Here's a great question from Andrew. So as vaccination availability expands, when do companies who have on-site testing with carbon reserve an appropriate for vaccination? And it sounds like their company is in the phase 1B tier 2 area. So kind of broadly, I guess, how do companies who are already working with get their staff vaccinated? And then there's a really cool, interesting question about whether many companies are going to require vaccination to get back to work. So do we have any insight at Carbon about when we can start doing vaccinations like we're doing for influenza vaccine? I mean, that's something that's definitely in our wheelhouse to do, and we can probably get it done in a matter of hours, if not days, depending on the company size. But what are your thoughts on?
Yeah, I think we have capability today, and obviously we do because we're doing it in conjunction with city partners and helping. It really does come down to what we've been discussing already around supply, as well as kind of the who is distributing the vaccine within that locale, i.e., that county, and how does Carbon Health fit in with that within that. What I will tell you is that luckily, because Carbon Health is involved at the highest levels in helping this whole effort, we don't necessarily have the ability to jump the line, but let's just say we will be at the front of the line and be a provider of choice in getting distribution. So I know that that's sort of a non-answer because I can't tell you exactly when. I can only tell you that we're going to be one of the first to be able to offer that because we have developed the trust and the awareness to be able to get a vaccine and get it out into the community as soon as it becomes available through that channel. Right now, it's still all really being done through local government distribution.
Sujal, I've got kind of a tough question for you. So I'm going to put you on the spot because of all the conversations we've had, and believe me, Sujal's going to chuckle, but basically the company's been going, 24/7 for weeks now on vaccine. But the controversial question and putting you on the spot is, let's say that we have a company in Los Angeles who we're working with. We have access to vaccine in Los Angeles through the county. Would we be able to do on-site services for those offices who we're partnered with? This is a question that comes from Allie. So if we had access to vaccines, could we go on site and vaccinate folks? And I know that's a big if because, as you mentioned, it depends on what the county allows us to do, but I'd love to hear your thoughts on how we would approach that.
And I think it's a great question. And how I would answer that is that, again, it's going to be not only dependent on supply, but also where we are in phase. So if your organization, and the question's gone from my screen now, but the gentleman who had posted the question about their company and their employees are in phase 1B tier 2, that's just around the corner. So if we're already in that phase and we have supply, then the answer is yes. We can figure out a way to be able to do that as an on-site event because that might be the most efficient way of getting your employee population immunized as quickly as possible. So I think the answer is yes, but it really takes an alignment of phasing so that we're not unintentionally trying to jump the queue, as well as making sure supply is there. But on the logistics and the capabilities, it's what we do.
That's awesome. Actually, I'm glad I attended this because I didn't know you were going to say that. I thought, but that's wonderful, and it's clearly where we've wanted to go with carbon. I think we have really the most experience going into the at-risk population. So whether that's nursing facilities, we've got a fully mobile platform where we can go anywhere. So hearing you say that it's possible to do in-office vaccinations, if we had the supply and the okay from the county, that we would absolutely do that. And so that's really awesome. I got
we would just make sure that we're using the same protocols we are now, which is, making sure there's clinical supervision, observation, ability to take care of anaphylaxis if it was to occur.
Yeah. So it has to be done safely, and even though it's rare, one of the parts of the protocol is to observe people for a certain period of time after vaccine. So we'd have to make sure that we have a safe space to do that as well. Great. So here's the question regarding whether the trend, if you get the sense, whether the trend is going to be that the majority of companies will require employees to get the COVID vaccine once it's available to everyone. Do you have a sense of how that's evolving? I know you've been interfacing with both companies and government around this.
Yeah, and I think it's interesting. I think that there, again, it feels like it's very much an individual company choice right now. There has not been kind of like a public consensus around it, but I see people falling into two camps. One is that it will be made available. There will be education around it. It will be encouraged, but not mandated. And then there, even the mayor of Los Angeles was saying that if supply is there And if we have an understanding that there have not been complications to date, that very likely he may make this vaccine mandatory for his frontline workers, such as firefighters. So I think that as we get more information about safety, efficacy, et cetera, then I think similar to how we do with flu vaccine in, say, healthcare settings, I think it will make sense. But I think that right now it feels a little bit early to call that. And we don't want to necessarily unintentionally create more kind of conflict or adversity to the vaccine. I think the most important thing is just to make it available, get people educated around, some of the myths about the vaccine. It's not going to change your DNA. You're not going to turn into an alien. It's not that. They're not inserting microchips. It's dispelling a lot of those myths so we can get over hesitancy, so we could just get towards herd immunity.
Awesome. So the next question, and I'm going to try to go through these fairly quickly so we get through all of them, but does the vaccine help you become immune forever, or does getting the virus itself cause you to be immune forever, even with the new strains? The short answer is we don't know exactly. I think that so far, most of the data that you may have read about have come from the laboratory environment, where scientists are looking at the blood of people who've been vaccinated for an immune response, and then they're adding the new strains to that blood to see whether the immune system is still robust enough. What we can say is that people who've been vaccinated, actually, their blood seems to be more reactive with the new strains of coronavirus. And so there's a thought that the vaccine might be actually even more effective than being infected by itself. The other component of that question that's worth noting is that the virus is mutating quickly, and the more people who are infected, the more chance there is of the virus mutating to the point where our vaccines won't be effective. And so if you're reading about there's a race against this virus, and if you're hearing about companies like Carbon really kind of going out front and saying, we are ready, we're capable to get vaccines in people as soon as possible, we're using technology to get that done, it's because there's a literal race between getting enough people vaccinated so that their immune systems can fight even these new variants before the variants get to the point where there's enough mutations build up that the vaccines aren't effective. So where we may end up is a situation where, just like the flu virus and the flu vaccine, that we're getting vaccinated annually against COVID. And if that is the case, we've got the technology to create these new vaccines with the mRNA tech that was developed. And I think you've got smarter and smarter people and companies like Carbon Health that are willing to go out there and do mass vaccine events or corporate vaccine events. Prediabetes is not considered a compromised condition for coronavirus. Diabetes by itself is, but not prediabetes. And then a great question from Jade here. We're a partner that does the mail-in testing, as we're not near a physical Carbon site. How do you envision assisting those partners with getting their associates the vaccine? Or will you only be able to offer assistance with vaccination to those partners that are near a Carbon site? I've got my answer, but Sujal, I think this was regarding if it isn't a near site.
Yeah, and it's a great question. Just as I was mentioning with the testing directory that we developed, because we realized that we wouldn't always be the access point for testing, we're doing the same thing for vaccination. So what we fully intend is to have that awareness across the country and help curate the best access points for our enterprise partners. So whether we're delivering the vaccine, we will make sure we're helping to connect our partners to the right sources and the right access points.
And another shameless plug, if you have connections with your county officials, please make introductions to us because we'd love to be a part of the solution, even if we don't have clinics in that area. There's a very kind thank you for information about the vaccine and why it's important to get vaccinated. Do we have educational material to share with our partners who can then share it with their employees? I think the short answer is yes. So we have an FAQ that we put together that go over many of these questions, and hopefully if you reach out to your carbon partner, they'll have access to that FAQ. And then another question from Kaylin, do you have those relationships with different states or just California? So Sujal, are you able to speak to which states we're going into or potentially are developing relationships with, or is it kind of premature at this time?
It's a little premature, but I could tell you that we're already having discussions with a number of states. And our intent is to be able to help wherever we can, in whatever capacity that we can. So more to come on that, but I think it's a little bit premature to start listing the states, but just know that there are a lot of states that have reached out to us, and we're also proactively reaching out to a lot of different levels of government to be able to offer assistance.
Awesome. Yeah, we're kind of open arms to organizations that we can work with. So another amazing question from Brett. And Brett, thank you so much for asking this. When should vaccinated individuals stop participating in the company's testing program? After the first dose, after the second dose? When do you think state and federal public health organizations will update their travel protocols restrictions for those who have been vaccinated? So two incredible questions.
Yeah, these are great questions, and Brett always has good a little shout out for Brett. So the first, almost paradoxically, I believe that as we start to get more vaccinations underway, there will actually be more reason to do surveillance testing, because I think that invariably we're all going to start to let our guard down. We're going to be tempted to not do the same types of infection control we've been doing in workplaces. And I can say with high confidence, everybody that's on this call who is a partner with us has been amazing during this pandemic, not only in the thoughtfulness of putting together plans, but more importantly, on the executing of those plans and holding themselves accountable to maintaining these protocols, which is why we haven't had outbreaks within our workplaces. That's knock on wood. But what we want to avoid, going back to knowing that the vaccine may or may not prevent infection that can lead to transmission, we will need to keep doing surveillance testing so that we don't end up with a mixed population of vaccinated, unvaccinated, and then somebody unknowingly will create an outbreak within the workplace because they thought that they weren't a risk of transmitting. So I think that for the foreseeable future, until we get clarity from the vaccine manufacturers about the data around transmission, I think we're going to need to do surveillance testing. And then secondly, will be once we have widespread vaccination throughout the population, so that means not just your employees, but their families, their extended network that they're circulating with, that's when we'll be able to more kind of take a breath and relax and maybe be able to put the masks aside. But that is going to be a little bit longer term. I'm not sure we're going to see that. I don't think we're going to throw away masks in 2021. And I think, Brett, the other question around, or Cesar, I'll let you comment on that first before we move on to the travel.
Oh, no, I just wanted to, it sounds like from what you're saying is the case scenario is everyone is vaccinated, so that we know that there is a low risk of getting, gravely ill from coronavirus. And so the second is an important point that you made. And we need data on whether or not people who are vaccinated can transmit the virus. So both those things seem to be needed really let your guard down and try to alter these protocols.
Yeah, yeah, that's right. And I think that, I think that actually leads to the answer, or what I would presume might be an answer for the second one, which is, when will travel protocols or restrictions change because of the presence of vaccination? And I think that if we're talking about domestically, I think it's going to all depend on how quickly we can achieve status of herd immunity. Meaning, are we at 70, 80% of the population that's been vaccinated? That's when I think we'll start to see even more restrictions removed around mobility and kind of commingling cohorts. I think looking at that internationally is very tough because every country is going to be moving at a different pace. And I think that it's gonna be complicated for a while. That's my prediction.
Is Carbon creating a vaccine passport?
Absolutely.
Or
Yeah. Yeah, we will have a vaccine passport. It'll be accessible, and we want to position ourselves so that it's shareable and usable, so it actually has true function and integrate in ways that help to provide the access control that I think we're looking for in that type of functionality.
yeah, and I think one of the nice things about these partnerships that we have with people on the webinar is that we also have partnerships, airlines and airports, and so we're really getting into the deep details of how a vaccine passport could be used effectively to keep everyone safe. And we're also actually looking and working with large venues to do the same, so that people can go back to kind of more normalcy in their lives. So perfect. Well, I know we're kind of at time. Yeah, I just want to thank everyone for joining us and bearing with us, through this process. We'd love to, if other questions come up, please, reach out to the person you're working with at Carbon, and they'll send them to us. And we'll get the FAQs out to this group as well. So thank you.
Thanks, everyone.
Okay. All the best. Bye.